Welcome back at 7:14. The CDC says the so-called kissing bug disease is now regularly occurring in the U.S. According to a CDC report from 2024, an estimated 280,000 people in the U.S. have the disease and often have it without knowing. Dr. Lutz joins us this morning to explain what it is we're talking about here. I know you keep hearing about it likely, so we're going to help
Good morning,
prevent
Kelsey.
you from getting it. Good morning, Dr.
That was a beautiful picture of one that they had there. Unlike bed bugs, which are tiny, like the little size of sesame seeds or something, these are larger. These are larger than a penny, and you can really see them. And like a lot of criminals, they like coming out at night. They don't do much in the daytime.
Where can you find these bugs?
Well, they hide out in cracks and crevices. They can be in sidewalks. They can be all sorts of places. And the kissing bug itself is not the problem. It's a parasite that it commonly causes. So what happens is the kissing bug gets on you. They really like to kiss on the face. So they kiss in the middle of the night. You wake up, you may have a swollen eye, you may have some fever or something, and that goes away for a while. That's called the acute phase. But then the chronic phase, 20 years later, heart failure.
You said 10 or 20 years
10
later?
or 20 years later, this parasite has been in your body this entire time, and it invades cardiac tissue, gastrointestinal tract tissue, and can cause enlarged colon, enlarged esophagus, and enlarged heart. And especially in Latin America, where it's much more common than the United States, it's a large cause of congestive heart failure.
So people, I'm sure at home, were thinking, wait a minute, back up. I thought kissing disease, it implied that people are passing it to each other. That's not what's happening here. This is from a specific type of bug.
No, this is not mononucleosis.
Right.
This is a parasite that's found in the bug's feces that gets into the bite wound of the person scratches and gets in. We actually have a local scientist, Dr. Patricia Dorn at Loyola, who's, I guess, the kissing bug mother of New Orleans almost, and she's written extensively about this, including cases here in New Orleans. One of her articles was called, "Are We Cuddling Up to Kissing Bugs?" And just a few years ago, a study was done. They looked at over 3 years, 39 blood tests had been ordered for serology for this bug at UMC and at Children's Hospital, and 4 turned out positive. So it is definitely something that we have. There was a good case report of a woman who lived over on the West Bank in a large wooded community who had numerous bites and was found to be infected.
So you said, we were talking at the top of the conversation here, that most people don't even know they have it. You mentioned you might have that rash or fever. Initially it goes away and then it's essentially lying dormant in your system for decades. So how do you prevent it, / how do you know that you've been bitten by one of these things and then seek treatment to prevent the 20-year down the line problems?
Well, pets can actually carry this this bug around and bring it in from outside to inside, but most of the products that people give pets to prevent ticks and fleas will prevent that. But it thrives in crevices and cracks in concrete. I guess our New Orleans sidewalks are probably novena for the kissing bug. But it hides in like that. If you've got a clean, organized, well-put together environment, you're not going to have this problem. Now, if you go down to Mexico or Central America or Texas or Western Louisiana or New Orleans and stay in a real cruddy place that has cracks in the walls, that bugs crawl out at night, that's a different story.
Oh, now that my skin's crawling.
And this is not this is not the love bug.
Right.
This is not the love bug. This is not the bug that messes up your windshield on
the road trip. All right, Dr. Lutz, you got my skin crawling now. Let's get over to Hannah Guard.